called it. Yeah.
Yeah.
So, um, in year 7, I reached out to a career coach, and I just because I was just talking, talk, 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 talk. I didn't ever do anything. I would just talk about how unhappy I was, and
Hmm.
so I knew I needed help. So I called a career coach, and we worked together for a while. And I actually worked with her on how to tolerate dentistry a little bit better, how to cope with the challenges and how to make it better. And it helped for a little while. And then it really wasn't working. And I ended up getting therapy. I worked with a therapist. And just between that and a lot of soul searching, I finally started to realize that I needed to just kind of find a way to get into action. So
Hmm.
from year 7 to it took me about 3 years to make that transition out.
So I like to use the word niche at least once a podcast. So you are very niche because you're a life coach, but you are also a dentist. So I'm assuming the therapist and the life coach that you consulted with didn't have any dental background, correct?
Correct. Yeah.
Yeah.
And I love telling the story because it's so um indicative of why it's so important to have the dental background. Is I remember talking to her about being really unhappy and hating my career. And she was trying to help me understand how important, like, what's the one thing that makes us happy in career? What makes us feel fulfilled? It's being of service. And so she was trying to get me to see how could I be of service. And at the time, I remember feeling like a 4-year old wanting to just like stomp my hands and feet and scream and say, I don't want to be of service. I don't want to help people, like I
Hmm.
am beaten down and I'm jaded and I don't want to help anyone. And what was interesting about that is I felt like crap about myself,
Hmm.
because I was like, what is wrong with me that I don't want to help people? And I'm a bad person. I'm supposed to be this person who wants to help people, and I'd rather work with lab rats. And
Yeah.
looking back, I see this now. I didn't know it at the time. I see that dentistry is all about being of service to others. And what happens to us, the thing that burns us out and the thing that makes us feel so jaded, is that we are like taking that concept too far, and we sacrifice ourselves, we sacrifice our own well-being in the process of trying to be of service to other people. So we actually push ourselves to the opposite direction of it, and we can't do it anymore. We just deplete ourselves, so we don't want to help anyone. And that's something that only a dentist would know, you
Yeah,
know?
I had a similar, my story just it sounds so similar to yours where so I've been practicing 18 carry the one at a two maybe 18 years. So and I started seeing a therapist maybe 2 or 3 years ago when I finally said I need to start doing something about my mental health because like you, um, I didn't like any part of the profession. I didn't like the technical part. I didn't like dealing with the patients. I'm an introvert, so for me, getting the energy to see 30 or 40 patients a day was totally exhausting. I'd come home and I'd just want to like just shut it down and stare at the wall for an hour. So I started to see a local therapist who was great, but I was trying to put everything in context. She was not a dentist; she was a therapist, and I'd go into a long story about the office manager and the hygienist and the assistant and the whole context of my stress, and she'd be like, "So, what does the assistant do again?" And I'd be like, this is like I just spent like this exhausting energy trying to explain to this story, and she just someone who's walked in a dentist's shoes like yourself would be a lot easier for me to if to connect. Whereas this therapist was great, but she was not a dentist and didn't know the dental business or background or what we go through on a day-to-day basis. Um, so that part was frustrating, but it really, really helped me. That, along with so therapy, getting on some medications, finding the right combination of medications was a game changer. Um, I went through all the phases of dentistry, the associate. Um, I, I worked as like a traveling implant guy where I would place and restore implants in different offices. I associated in many offices, and then I went through the process of transitioning to become an owner, or should I just buy my own office, or should I partner in the one that I'm at now? And then I went through the process of becoming an owner. So each phase had its own stresses and totally different reasons. As an associate, like you said, you want to please everyone, the staff, the owner, the patients. You're trying to hone your skills. You don't have any control over your schedule or even ordering supplies. So, like me, I wanted to please everyone, and that is stressful, especially an introvert like myself. It takes a lot out of me to really engage and be social, and put that happy face on, even though I'm exhausted. Um, and then the whole process of even thinking about transitioning to become an owner was extremely stressful. Then becoming the owner was probably the most stressful part because you're dealing with the staff and all the business that goes along with it. And as you know, they don't teach you any of that in school. So I was just all those wearing those different hats and all those thoughts going through my head. I said I've got to do something. So that's when I started seeing therapy. I started actually doing less yoga and more tennis. I started getting back into tennis, which was really good for me. Just listening to music, stretching a lot, and then the biggest one was just not giving an F. I just stopped caring, and I'm not talking about caring about my patients or the treatment. I stopped caring what people thought about me at work. I stopped caring if patients didn't like me. I stopped caring if they didn't schedule that appointment. I stopped caring if the staff didn't like me. And it was this whole change of mindset, which probably took, a couple of years to do. That, along with getting my staff to work the way that I wanted to work, especially with my assistants. So now I actually have turned the corner and I show up to work and I enjoy going to work every day, and I'm not coming home stressed like I used to. So I went through a lot of what you were going through, but I was able to get out of it, and I'm a lot happier now.
That's awesome.
Yeah.
And I think the biggest key is the not caring about what people think of you. That's what it comes down to, because that's where, when you're talking to your patients or your team and you're feeling drained and exhausted by it, I kind of describe it as, it's not because you're connecting with them. It's because you're being that like dancing monkey trying to entertain everyone, and juggle and dance and make everyone happy and make sure they're having fun and that all the results are good. And that's different from really connecting with a person and helping them out.
Yeah, and no one wants a dentist in a bad mood. It's you got to always be
No,
on.
you have to. A friend of
And
mine one time said to me, he was like, we can never have a bad day.
mhm.
He's like, everyone else gets to have a bad day around me. My team, my patients, they get to come in and they get to unload on me and tell me what a bad day that they've had, but I never get to have a bad day. And that creates a lot of pressure. So I think that's awesome that you got therapy and really became proactive about helping yourself. And that's what we have to do. It's like, if you see something's going wrong like this, you got to do something about it. It's not
Yeah,
going to go
so
away.
yeah, and also, my personality being an introvert, I think there's a big difference being an introvert and an extrovert in this profession. So my partner is like, he's a total extrovert. He's like, he re-energizes himself by engaging and talking, whereas personally, I re-energize by staring at the wall for an hour. I need to decompress and kind of, settle down and not talk to anyone for a while. Um, so for me, going from room to room and making that patient feel like they're the only patient I'm seeing that day and being on, and meanwhile I have a patient in the other room that I'm still thinking about, but I can't let that hygiene exam that I'm doing right now know that I'm not totally focused on them. So for me as an introvert, that was really a big challenge and totally exhausting. Um, that along with the fact that we're doing surgery on someone that's awake, we're staring at this 1 millimeter space, um, and I was also, to top it all off, was having shoulder pain. So also having physical pain is mentally exhausting. So you had all those factors in, and I would get home and just be just toast.
Then you've nothing to give your family.
Yeah, exactly. Yep.
Yeah,
You get home and you're junk.
right.
Um, so to me, that was obviously a wake up call that I needed to do something and make some changes. And mentally, I just had to stop caring what people thought. And a lot of it was staff. As an owner, there was some drama queens and some. I mean, their staff was fighting and yelling at each other. People were crying, and I mean, there's all this stress in the office that was just tolerated for years. And I was like the bad cop coming in, like the new sheriff in town, and changing some things. And we had to get rid of some people. Some people left on their own and kind of weeded themselves out. But there was staff members that I didn't enjoy going to work with every day, and that's not a good thing. Especially as an owner, you're paying them. You want to go into work every day with people you enjoy working with. And if it's not in the cards, then either they need to leave or you need to get rid of them. But don't, take control of your practice. Don't let your practice take control of you, especially when it comes to the people you're working with.
Right. And I would add to that is when you see something's not working, don't stay stuck
Mm-hmm.
because nothing's, you're going to wake up a year from now and you'll be in the same place.
Yeah, I want to go back to where you said, um, that you felt isolated. This practice, this business can be very isolating, especially if you're a solo practitioner and you're the only one in the office. You can totally be in a little bubble, and now there's Dental Town, and there's a lot of Facebook groups and a lot of ways to engage with your peers. But when I was first, coming up, into my practice, into my career and associating, I didn't know about those platforms. Um, there was a few classmates that I would reach out to and we'd talk. But I was also doing something a bit different. Back then I was placing and restoring my own implants. So I was like the only one that I knew that I was doing that. And that really caused a lot of stress for me because I didn't have anyone to really connect with that was doing the same thing as me. And I was also doing some procedures that I think was a little out of my comfort zone. And I was constantly thinking about those patients at night. I just did a big bone graft or a large implant case, and those kept me up at night. Um, and it's not like other professions where you go out and you have that 5 o'clock beer after work, with your colleagues, like if you're, accountant or lawyer or working in an office, as dentists, you just go home and you take it home with you. So it's can be very isolating profession. Um, so I wanted to ask you about so you left dentistry, and then you wrote a blog that went viral, right? Can you tell us about
I
that?
did. Yeah. So I found that, so I started blogging. I was so stuck, I didn't know how to get out of dentistry. And so it all started actually. I decided to enter a video contest, like a travel show host contest where I had to make a 1 minute video and submit it and try to get people to vote for me. And if I won, I would win like a 6 month traveling stint being a show host for this, internet travel company. And I would win a house wherever I wanted in any of these cities that I was going to be part. Well, anyway, long story short, I didn't win. There were professionals applying and I just did it for fun and creativity. And when I was doing it, it was really fun because I had something different to focus on, something creative, something to think about, something to take my mind off of my stress. And then when I didn't win, I got pretty upset and I felt like I have nothing now, but this was so great. Like, how can I take this and create something out of it? So I was like, okay, if I can't be a travel show host, why don't I start a blog? And I'll blog about traveling and I like food and nobody read my blog. There's a million travel blogs out there. No one read it. I had like 7 followers. And one day I was reading a list of the different blogs. So I blog with WordPress, and WordPress is really good for community, and they'll oftentimes promote blogs on it. So they were promoting a blog that they thought was great, like a really funny topic, and it was titled 10 Reasons I Hate the Dentist. And she was kidding. She was being sarcastic. And I was like, oh, let me see what this is. And I was like, really? I just was so like, ugh, eye roll. We've heard this so much, all the things that you hate about the dentist. So I was like, you know what? I'm going to write, here's 10 reasons your dentist probably hates you too. So it was like a direct response to this blog post. And I sat on it. I didn't post it because I knew I still had a few more months in dentistry. And by this point, I had actually found my exit strategy. And part of helping me find that was blogging for about a year. It really opened up my mind and it opened up my creativity. And I started to gain a little more confidence that I could do anything outside of dentistry because we always think that we've been taught such specific set of skills in dentistry that there's nothing else we can do. And it's actually not true. But a lot of us think that. And so, I had been blogging that helped me get into something else. And then I saw this post knowing I was going to quit in about 3 months. I sat on it. And then when I quit, because I didn't want patients to think I was a bad dentist or a mean person. And it was very sarcastic, very tongue in cheek. I posted it it was like kind of like one of those kidding, not kidding types of commentaries.
Mm-hmm.
And I posted it, and literally that night it went viral. My phone was just going off with alerts, about comments and
What does that
people
mean to go
liking my
viral?
post. What's that?
What does that mean to go
So that's
viral?
a great question because I actually looked it up when it happened. And you've gone viral when someone who finds out about it,
Mm-hmm.
not from you.
Okay.
So I guess that'd be probably bigger than just gossip.
Yeah.
but yeah, so numbers wise, I had about 300,000 hits in 3 days.
Wow.
And at the time, I had 55,000 Facebook shares, which I've lost count of because I've switched over my website. So I don't have that tracking anymore. But about a week after I posted it, I went to a CE event that one of my friends' study clubs was hosting. And they had actually invited my husband to be a guest speaker to talk about ergonomics and stuff. And he's not a dentist, but he's a chiropractor and works with people with chronic injuries and stuff like that. So they invited me along since he was speaking. And I remember hanging out and somebody walked in the door with my post printed out and they were passing it around. And before everyone arrived, I was having a conversation with a dentist who's older and he retired because he was at the retirement age, right? And I was like, yeah, I quit dentistry last week. And he was like, well, I quit too, right? We were joking about it. And he ran over to me with this post, this piece of paper printed out. And he was like, you've got to see this. You're going to love it. And I just started laughing. I looked at it. I was like, I wrote that. That's how, when you know you're viral, you've gone
Mm-hmm.
viral. So that was a fun experience. What the reason I tell you that story is because I thought I was the only person in the world who was struggling in dentistry. This was 2011. No one was talking about burnout. If you look at all the classic signs of burnout, that's what I had. I didn't know it was burnout. I just thought I hated dentistry. And, it may have been a combination of both, right? I think there's a very fine line between the two. But the point is, I didn't know. I thought I was just the only one. And so when people were going nuts and getting so excited over these 10 reasons that we don't like our patients, the reasons they annoy us, and people were loving it. And so people started emailing me and reaching out and asking me, how did you do it? I want to quit dentistry too. And cheering me on. And even once you've quit, it's like a very insecure time. You
Mm-hmm.
don't feel great about it unless you've won the lottery or you've started this amazing other business. When I was still somewhat insecure about things. So it was so helpful to have this like built-in cheerleading squad for me to remind me that I was doing the right thing. And so, at this then to go to this meeting and have everyone is excited about this post that I wrote. And then we got into these conversations. Before that, I always felt like when I went to dental events, I felt like the conversation was always so fake
Mm-hmm.
between the other dentists I was talking to and me. And it was like, how's practice? Oh, it's great. How's yours? Oh yeah, it's great too. Yeah, cool. And then that's all you really have to
Yeah.
say, right?
Yeah.
It's so awkward. So part of that is because I was being fake, right?
Mm-hmm.
Like I was hiding this huge secret. um, but this one night we started having these conversations that finally felt real. And other dentists were saying things to me like, yeah, we are trying to plan for our exit in 10 years or whatever. And I had the best conversations that night because finally we were having a real conversation.
Mm-hmm.
So, if anyone out there is feeling like no one gets them, um, people get people get you. It's just, it's hard to talk about. And we are out there though.
It's that peer engagement is so important to, whether you're still practicing, to realize that you're not the only one going through the stresses of the profession, or like in your situation, if you left the profession, that there's a lot of people out there that, were going through the same thing that you were. Um, so now tell me about Lolabees and your um, uh, coaching. Would you consider yourself a coach, a consultant? What do you specify yourself
Yeah,
as?
I consider myself a coach. I usually focus on career with people, but we can work on anything because I've been trained to work on anything. But really, you talk about niche. It's mostly helping dentists who are unhappy in their careers.
Hmm.
And so, what's fascinating, and I love when I get the dentists that are really successful, they've built these $1 million dream practices. I love hearing from them and working with them because we all think that that's our ticket to happiness.
Yeah.
And and we all think that, at least when we were in dental school, we thought that, well, if you couldn't stay at practicing dentist, it's because you couldn't hack it. And it's
Hmm.
just not true. I mean, there are some of the most successful dentists in our country, or from other countries, who are so successful and patients love them. And maybe they liked it for a while, but they just are, either they're burnt out and they need to find a way to get over the burnout and find some joy in their career again, or it's time for a change.
Yeah.
I recently heard someone called dentistry a terminal career. And I
Hmm.
thought, well, that's a great description, right? This idea that we can't ever do anything else, that we're failures or we're bad people. So, you know, I work with people who they just know they need to change something. So
Hmm.
whether it's changing how you approach your practice so that you can have more happiness, becoming a better leader. You know, a lot of times I'm hearing from young associates that are so unhappy. They're just a few years out. And part of it is, and you see this when you're in your 40s, right? But it's hard to see then. Part of it is their leadership. It's harder for them because they're wanting to be liked so much
Yeah.
more, and they're the same age as their assistants, or you know, their assistants have been there longer or they're older. So, you know, helping with that, but also helping people who are saying, I need to get out. I need to change. I can't do this career anymore because they don't know what to do. You know, earlier I mentioned we're trained in such a specific area that it's not that translatable into other things. So it's helping people really get to know themselves again and figure out, like, what do I want to do? And then gain the confidence to know that you can do it and have that built in cheering squad like I gained from my blog post, because without it, it is so normal to like get confidence one day and take one step forward, and then something happens and you think, what am I doing? And you want to just take two steps back. And when you do that, you just stay on the hamster wheel, and you
Hmm.
really can't get out of it. So it's really helping people make the decisions that they need to make about their careers, and then getting into some type of action, because I'll tell you, I know what it's like to just talk and be and no action, and it's really painful. And if you can get into action, then you can start to build momentum, and ultimately there's so much more out there in this world. And dentistry is great, but there's just more. Like, I'm so glad I had to leave dentistry altogether. I went into weight loss coaching. I started a weight loss business. I knew it wasn't going to be my forever career, but I needed out. And now I'm back. And what I'm learning over the years is I loved dentistry. I just didn't like working on patients.
Hmm.
So for me, it was the patients. It wasn't the staff as much. It was the patients. Um, so there's a lot of different ways we can be in this field and out of this field.
Now, your clients do, is it a mix where some of them you work through their issues and give them that, that action to, and then abstain in the profession? Um, is it like 50-50 where some just totally leave, or there's a mix where some cut down their days? Because I'm just thinking, if you're, let's say you're year three and you're miserable, but you're $500,000 in debt, what do you do?
Right. Yeah, that's a great question. So that is oftentimes what happens with the younger dentists that I work with is they've got so much debt that they're just trapped. So um yeah, we work on how can they find a little more joy in their careers, and how can they tolerate it and cope with it and manage it. And it's not easy. It's pretty hard, but it's a good way of really finding out eventually, is this the right career for me or not, right? And usually people find me, and that's just because of my online marketing, I guess. My online verbiage is really geared towards career change, because I talk about my story so much. But I get a lot of people who come to me thinking that they want to change careers, and once we talk, they realize they want to try it out. You know, see, can I change things? And some people will redesign it, like you said, to cut down their days. I mean, this is all about how can you design your career on your terms. And that's what's awesome about dentistry, is you can work 2 weeks. I mean, sorry, 2 days a week if you want to, and if you can, and if you've set your life up that way, you can totally do that. And so, but we still need to create, like, what are you doing in your life to make those, even those 2 days, tolerable.
Hmm.
So yeah, it's people come to me because they want to quit, and it's probably 50-50. Some of
Hmm.
them ended up wanting to stay in, and then the other ones, I mean, they just get to the point where they know, they're like, and when you find yourself saying, this is kind of my new favorite thing that I keep finding myself saying over and over is because I said this, and people say it to me all the time. They say, I feel like I'm dying inside, but I'm not sure what to do.
Mm-hmm.
Or like, um, this is crushing my soul, but I'm not sure what to do. And I think dying inside and soul crushing, is that ambiguous? You know,
Yeah, you
like
need to do
it's
something.
pretty
Yeah,
clear. Like if you're
yeah.
dying inside, something's wrong and we need to look
Mm-hmm.
at it. So I said it too, but it's because listening to that true, that's your intuition speaking, and listening to what your gut is telling you is very inconvenient, and it creates a very uphill battle. It's not easy. You can look at me now and it looks like doing what I did was so easy, but it's a very long, it can be a painful process, but at the end, it's so liberating. If it's what, if that's the right, yeah, by the way, I'm not here to make sure everyone quits dentistry, right? Like I wanted
Mm-hmm.
people to stay in
Mm-hmm.
dentistry. And so that is what I help people do also.
But you kind of you get to the root of the issues, kind of create a rethinking of what's going on and why they're so miserable, and then create a plan of action where they actually follow through and do it, not just talk about it, but do it and get that motivation to do it. Is this all one-on-one? Is it all through phone or Zoom? How do you communicate with your clients?
Yeah, it's one-on-one coaching. I've been doing it over the phone because not every dentist who wants to do this kind of work is in Denver, right? So I've been doing it over the phone for years. And now I've added Zoom because people are wanting to to connect face to face since we're so isolated again um, with COVID. But either phone or Zoom like this, and it hasn't really changed because that's how it was set up beforehand, which
Mm-hmm.
is, I'm not gonna lie, pretty nice. But yeah, we do one on one, and I also have a conference that is new, and it's like nothing that's ever been offered for dentists ever. So I'm pretty
So,
excited about it.
so explain what the conference is. Is that's all, I'm assuming also through Zoom. How does that work?
Yeah, we have a platform that's similar to Zoom, but different. And so it's a virtual conference. It is a full day conference. It's actually it's called the Next Dentist Career Conference. So it's helping people explore, working with me one on one is a much bigger commitment than a one
Mm-hmm.
day conference. I work with people for 3, 4, 6 months at a time. This is a one day event where you can really just kind of dip your toes in and find out, is career change right for me? And if it is, here's how I can take some steps to move myself forward. And so it came about because I've been doing this one-on-one coaching for about 4 years. And I had a physician reach out to me just out of the blue who does the same kind of work with doctors. And she started a conference um, to help more physicians really gain access to this type of work and this type of information. And when COVID happened, she had to take the conference virtual and was really enjoying it. So thought she wanted to branch out and asked me, like, she's a stranger, just asked me if I wanted to partner up with her. We got to know each other a little bit, and turns out we are great friends and work really well together. And so we are putting on this conference that she's done with physicians. And
Mm-hmm.
she always tells me that physicians are about 10 years ahead of dentists in this. Like 10 years ago, physicians were saying there are no other jobs out there, there's no options. And now they've really come together as a community to create options for physicians who want to get out of clinical dentistry. So that's what we're doing. So we're teaching tips, like very concrete tips, to help you, one, understand if career change is right for you. If not, then if career change is not right for you, then how can you design it, maybe diversify your career and get in like what you're doing. You've got this new business that's so exciting. I don't know how new it actually is, but you've had this for a while that's like giving you variety. You get to
Hmm.
practice and do this. So if you don't want a career change, maybe it's just branching out. But we get special guests. We have special guests who are sharing what they do outside of dentistry. And so this time around, our first conference is in November. This time around, all of the dentists have left clinical. Well, one of them has more of a non-traditional clinical job.
Hmm.
She owns a whitening spa, and the other ones have completely non-clinical jobs outside of dentistry. And they're going to share what they do, how they got out of dentistry, what they do, and how our viewers, like how our audience can do it too. So we're going to have a lot of concrete tips to help people get started. Have I gone too long? Does that answer your question?
Yeah, I was going to ask you. So you have some presenters, and then is there a way for the audience to engage with each other, like through chat
Yes.
or groups?
Thank you for asking that because we do have actually an hour and a half of networking. It's divided up into two different sessions where people, other dentists, you can get into these small rooms. Zoom calls them breakout sessions. I think
Hmm.
we have these little tables you can pop onto and then talk to up to six people at a time. And so you can talk to the speakers and get more specific in your conversations and ask questions, or you can network with other dentists. And the networking with other dentists is what keeps us going when we're trying to make this decision.
And does
So we,
your partner also is it just a dental, just for dentists, or do you have a
yes,
combination of physicians and dentists?
yeah, it's she's the only physician. Um, at, but the all the like I'm this is for dentists by dentists. So
Hmm.
all the our five guest speakers are all dentists and me.
What
So
about
yeah,
your
and all of
husband?
our attendees are dentists.
Are chiropractors as miserable as dentists, or are they much happier?
I don't know. It's a good question. I mean, my guess is it would be the same, right? My
Yeah,
husband,
although
he's one of the ones that
everyone,
likes it.
yeah, I love going to the chiropractor. I love getting that.
Yeah, I think
My
it's could be a little different, right?
Yeah. Um, well, thank you so much. Do you have any last nuggets or words of wisdom for the young dentists out there, before we wrap things up?
The young dentist, let's see. Okay, start off by just recognizing your boundaries and you can actually what I mean by that is you can take care of patients and you can take care of yourself at the same time. You do not have to be that like dancing monkey entertaining everyone and taking care of them while you're sitting here juggling everything. So just take care of yourself and
Yeah,
then
it's so
less
true.
burnout, right?
Yeah, it's so true. Take care of yourself, take care of your mind, and do things that make you enjoy the profession and things outside of the profession that can help you, decompress from the stresses. So, all right, Dr. Laura Brenner, thanks so much for joining us. That was truly inspiring. Again, go to Deals for Dentists and click on the Lolabees listing. Enjoy $50 off using the exclusive coupon, and that's for the networking conference. Also, if you mention this podcast, you get $100 off Dr. Brenner's one-on-one coaching programs. So, thank you so much for joining us, and let's try to be in touch and see what's new in your world in the next 6 months or a year or so.
Yeah, absolutely. Thanks for having me. Let's go back to Tulane again. Let's go visit New Orleans.
I keep saying that I'm going to get back there. Well, now, now I barely leave my house because of COVID, but after I graduated, I said I'm going to come back every year, and I have been back maybe 3 or 4 times. But it's such a great city and such a fun city. And for those people that Bourbon Street is not New Orleans, that is a very touristy place. In fact, I went there for a 40th birthday party, and all my friends wanted to do was just hang out on Bourbon Street. I'm like, there's so
Ugh.
much more to the city. Bourbon Street has this combination of, it smells like vomit and urine and booze, and it's a, you know, it's a dirty street. Um, Great for tourists, but you know, for people that spent 4 years there, there's so much more going on in the city. That's the music, the food. It's just such a great city. So thanks so much again. Let's be in touch.
Yeah, thanks so much, Eric. It was really fun talking to you and reconnecting.
Yeah, that's great. All right,
Yeah,
take care.
thanks. You too.